Okay, when you log into your patient or you go onto their chart, you have your tabs up here. Obviously we don't see the code documentation tab, so we can go over here, click your down arrow, and scroll until you see it. Then we have code documentation, and we can star it, and it will bring it up here. So I recommend that you do that on your Epic. That way it's right there in an emergency. You click code documentation. And this is what will pull up. You can use this for a code, or you can use it to document your rapid response. You've got all of these tabs here. You have to choose one of these to start them. So if we started a code, say we walked into our patient's room, we don't have pulse, we start compressions, and we hit the code button, you can hit start, and it'll start your code. Automatically, it'll start these timers. It'll start your pulse check for 2 minutes. It'll start a timer for the duration of the code, and it'll start a timer for your epi. Obviously, as we give epi and as we do pulse checks, these will reset. This quick bar will stay at the top at all times. That way you can quickly throw in vitals. So your heart rate's 30, O2's 21. Can you feel a pulse? What's your rhythm? Sinus Brady, and you can file. And you can add those as often as you need. At the start of your code, you should always come in here and add a PEDS code weight. That will do all of your math for your epi doses, any of your code meds. It will have your code weight in there. So say our code sheet, we're using our code weight, our kit is 12 kilos. Just say it was a bed weight. We'll hit accept. Now we have our code weight in there. You can add blood products if you give any. If you give rapid infusion, what kind of blood products you're giving. You can also add what staff are there. This may be kind of hard in the middle of the code, but you can do it after the fact. You can ask, or you can see when they arrive and when they were paged. Any of your attendings, residents, RTs, pharmacists, NPs, charge nurse, all of those. So you can add them to your code team. So here's most of your code documentation. You can add just blank notes for what happened. At your code onset, it'll ask you questions like, were they conscious? Did you see it? Was there a pulse when you walked in? Were there respirations? Were they ventilated before it? What kind of ventilator were they on? If you want to do more in-depth vital signs, rather than just throwing in a quick heart rate, O2 up there, you can do, this is what your normal vital signs flow sheet template kind of looks like. You can even throw in, especially in the PICU and the PCICU, did they have an A-line? Are they on central venous pressure monitoring, ICP monitoring, any of those? For interventions, similar to up here, do they have a pulse? What kind of rhythm do they have? This is nice for when compressions were started, if they're still going. If you defibrillate the patient, and what your shock is, if you do cardioversion, if and when you intubate, if you have to do a needle decompression of any sort. So that's really nice. If you end up putting your patient on ECMO, it has when ECMO was deployed, who was at the bedside, and all of your information that you need for when you deploy ECMO. This is more pertinent to PCICU or 3A, but if they have pacing wires, what kind of pacing they're on, you can chart when you notified family, providers, social work, transplant services. Oops. And then, you know, obviously if your code does not end in survival, you can chart time of death and all that. And then if your code ends or you spontaneously resolve, you can click here when your code ends. Notice our timer at the bottom. We're late for a pulse check. Again, more ECMO documentation. And then this is nice for the medications. Notice this warning, only drug allergies and dose warnings will show up for one-step medications. It's not gonna show any drug-to-drug interactions. So if your kid is on drips of any sort and you're having to use a line that has other things running through it, it's not gonna show you that drug-to-drug interaction. Obviously during a code, that's not ideal. You'd like to have a separate line and hopefully you'll disconnect everything, but in the event that you don't, or you have things running through the line, it won't show that. So it has all of your common code meds here. It has your epi, atropine, sodium bicarb, adenosine, calcium chloride, amiodarone, all those things. Notice here it has the 2 different doses of epi. This is your IV epi, and then this concentration is for your ET tube epi, maybe, if it will load. It's telling me I have to cancel. It has fluids in here, any of your reversal meds like your Narcan, and then any RSI, rapid sequence intubation meds, are also in here. So like your VEC and your ROC. You can also add drips that you start, and some PICU and PCSU specific meds. If you start a new IV or get a new line or access during a code, you can add it really quickly in here, as well as any tubes like an NG tube, chest tube. Those will be different than like an ET tube. ET tube will be under airways. You can add it to your avatar. When it was placed, what kind of blade, what kind of size tube, if it's cuffed, and all of that. If your kid's on pacemakers, especially in PCICU, if they've got a pacemaker or a VAD, you can add all of that stuff there. And then if you can even use this for, you know, rapid response. So similar things. Start like when you call your rapid response, you can do vitals, eyes and nose, your assessment, your pews throughout your rapid. You can quickly add those in there. What were your interventions? Or if you're doing, you know, if you call a code stroke, you can do your stroke assessment here. Yeah, and that's kind of what your code documentation looks like. It's super easy. So I recommend adding this tab, that way, you know, it's up there in case you do need it. And yeah, I recommend y'all go play around with this. It's really nice and get super familiar with it.